So if you were to ask me, Ethan, what's the best part about being a pharmacist? I actually have a lot of different answers for you, and I'll share a few with you today. First and foremost, there's something to be said about how uplifting and gratifying it is to help the patients that you serve, whether it's providing them a recommendation or giving them some sort of education on the medications that they take, to which then betters their health outcomes. Feels great. It's awesome. In addition to that, working with our nursing and physician colleagues as well to provide recommendations. Nothing makes me more happy than a doctor asks me a clinical question and boom, I know the answer right there. I can give it to you. Another cool part of pharmacy practice is just how versatile it is. Of course, you'll see a pharmacist, in a grocery store pharmacy or an independent drugstore, that sort of thing. Pharmacists also work in hospitals as well, and some pharmacists work in industry, with drug companies, whether it's educating providers about certain medications or even doing the research side of it too. So, when you pursue pharmacy and you try one avenue of practice and maybe it doesn't jive for you, there's a lot of other places you can work. And that's super cool how flexible that is. I personally work full time in the hospital, but I also work in the community as well. And I really like having that variety in my practice. Touching on jobs too, at least at this moment in time, there's definitely a lot of jobs. There's a lot of short staffing. Most pharmacies you go to, be it hospital or community or wherever, people want pharmacists. They're looking for pharmacists, and they just can't fill those positions. Certainly more so in rural areas than the big cities, but either way you look at it, there's work to be done if you want to do it. I really appreciate how clinical the profession is and not physical. Shout out to my nursing colleagues. You guys are awesome. You guys work really hard. I don't know if I could wipe butts every day, but I applaud you guys who can. And yes, depending on where you're at, work could be busy and keeps you on your toes, and there's lots to be done. And yeah, there might be times where that's stressful, but ultimately, I think within the profession, the work-life balance is pretty good. you know, 6 years of school investment, pretty good pay right off the hop, and it continues to get better and better if you work really hard. And your hours are pretty good, depending on where you're at. It might be 8 to 4, 10 to 6, 9 to 5. Some pharmacies may have, late hours, or if you work in a hospital, you may be overnight on call. Here